Welcome back to Ask the Expert, where today we're sitting down with Kaitlyn Bravek here with the Wound Care Clinic. Give us your official title and how long you've been with Greene County Medical Center.
Yeah, so I am a physician assistant. I've been with Greene County for just over a year, 2 years in November. And that's about how long. And I've been in the family practice setting currently.
So, the Greene County Medical Center opened a new wound care clinic back in May. Now, what exactly is all encompassing in a wound care clinic?
So commonly, a wound care clinic is just like any other specialty field, except we just specialize in wounds. So if you think an opening on your skin that just doesn't want to heal, you get to come and see us, and we do a little bit more in-depth treatment than you get from a primary care office.
So, being this a new service, what's kind of the inspiration behind the addition of this service?
So it's something that the community needed, right? It's something that you don't think that's a need for you until you experience a wound. And there's actually higher prevalence for this in our community than we know. And so just able to bring this service to the community and apply that adequate care.
Now, I know there's a whole process that goes on behind the scenes here. What was that process for getting a clinic like this up and running?
So for us specifically, we partnered with Healogics, which is a nationwide company that specializes in wound care. So what they do is work with other health systems to help these clinics get up and running. What they do is kind of behind the scenes work. What chairs are we going to use in our exam rooms? What equipment do we need? Those different things. They've been able to help us with that. They also, on the clinical side of things, have been able to provide adequate training for myself and also the people that will be working in the wound care clinic.
So definitely a lot of the behind the scenes stuff that the public doesn't always realize, but makes a big difference in patient care. What is your role in all of this?
So I am the main provider that will be heading the wound care clinic. So you will be coming to see me commonly once a week. So we'll get to know each other pretty well.
So you mentioned being the primary, but what kind of training or certifications do the providers that are at the wound care clinic typically have?
So for myself, my PA degree or my physician assistant degree does cover my training and certification I need to work in this clinic. Also, like I said, that partnership with Philogix has given us further education regarding the wound care and different treatment plans for individuals.
Now I know it's not a one person show. There's a big team out there. Who else is on your team, and what are some of their positions?
So we will have a wound care nurse specifically who's been trained in wound care. She actually has a certification for this, and her name is Carly. She'll be also someone you'll get to know very well because she'll be right by my side treating patients. And then we also have Katie. A lot of people know her from the family medicine clinic, and she's working a little bit more behind the scenes to keep a clinic running.
Help me understand, how do you approach wound care differently than the more typical treatment options that are out there?
So with wound care, we have to think why is something not healing? So that kind of opens up to different treatment options just for that reason. Do we need to do extra testing? Do we need to use these different fancy dressings to close a wound? Do we need to do certain debridement or procedures to help a wound heal? Those are things that you're not going to commonly see in if you came to see me in the family practice side. We'll be able to do that more in the wound care side.
So just kind of, yeah, looking at it from the angle of, okay, why? Why isn't this healing this way? Now, do you offer any advanced technologies or therapies to assist with that?
Like I said, procedure is a big one. So debridement of wounds is a big thing. What that does is help reset the wound in a way to help reactivate the healing process. Some wounds commonly just get stalled in that process of healing, and this helps just reset that. So that's something new that we'll be bringing to this. And then all the, like I said, the fancy dressings and all those different things that we'll be able to help with as well.
So kind of walk us through just to overcome some of those questions that people have in their mind. What can a new patient expect on their first visit to a wound care center?
So, specifically with our wound care center, your first visit is going to feel probably a little bit long, not your normal visit to the family practice clinic. It can take from 45 minutes to an hour to get established with us, but that is because we are going into such depth into why this is not healing and starting that process. Of course, those visits will shorten with time, but your first visit will be a little bit longer than probably what you're used to.
So, Caitlin, how do patients go about getting into the system or getting their first appointment here at the wound care clinic?
So, what the patients can do is talk to your primary care provider. They can help get you a referral and get you set up with the clinic. You also can call the hospital at the main direct line, and they can also help you get set up with a possible appointment.
Caitlin, thank you for taking a few minutes to join us today. Do you have any final thoughts, any final comments that you'd like to get out to the public regarding the recently new wound care clinic here at Greene County Medical Center?
All I know is we'd just be excited to see you in the wound care clinic and help assist you on sometimes a challenging process to heal a wound, and we hope to be the support you need to help that process.
Again, Caitlin, thank you for taking a few minutes out of your busy schedule today.
Thank you.
You've been listening to the Ask the Expert, where I've been joined by Kaitlyn Bravek, physician's assistant here at the Wound Care Clinic at the Greene County Medical Center. We'll be back with more after this.